The treatment of aortic stenosis has been revolutionized in the last 20 years since the advent of what we call as a transcutaneous treatment of replacement of the aortic valve. We also call it either TAVI or TAVR. This treatment was discovered in the year 2001, and since then has made the lives of very many people absolutely different, especially if they're older. We do this treatment in our hospital for the last 12 years, I would say. And we get a lot of patients now where we can insert a valve mostly through the leg in patients who have severe aortic valve disease in the form of aortic stenosis, which is the narrowing of the aortic valve. Although we limit this treatment to people who are more than 65 or 70 years of age, a time is not far when these valves will become more durable and will be offered to even younger people. The treatment requires only a couple of days of admission, and it is done completely percutaneously. That means no cut is made, and the patients do not require any anesthesia except the local anesthesia. We can do it even without any sedation. So I would say that treatment of aortic stenosis, which is the narrowing of the aortic valve, which results in shortness of breath, sometimes chest discomfort, sometimes episodes of fainting or vertigo or giddiness, and ultimately failure of the heart, is become an amazing treatment and leads to a very quick recovery without a long hospitalization.